Senate Finance Committee will come to order. Good morning, everybody. It's Thursday, January 21st. I really appreciate this opportunity for MMB to come back and talk to us about the, I don't think they got through the slide deck, but so we're going to continue the review of the CRF fund and the COVID-19 Minnesota fund and their refinancing mechanism that they did in last December. So with that, I believe we have the commissioner is available, and also Britta Rattan, our state budget director, Melissa Lam-Young, the executive budget officer, and Marianne Convoy, our executive budget officer, and Amy Jorgensen, the director of the COVID-19 Response Accountability Office. So not sure who would like to start first, but
I'll pick it up, Madam Chair. Thank you, Madam Chair, members. I'll turn it over to Britta and our team as we get it set up. I just want to reorient ourselves. We did, as you said, I got about halfway through the presentation. There's a number of different pieces of the financing strategy. I just want to reiterate, this has been a work in progress. As you all have experienced and know as well as we do, that the terms and the availability of federal funds and whether they could be carried forward, whether they need to be used, whether the rules, those have been a state of change ever since they were first granted last spring. We continue to adapt and figure out strategies to maximize those. One of the things that I just want to point out, because I don't think she'll do it herself, is in addition to the outstanding work that the budget team has been doing, you should just know that Amy Jorgensen's actually been on national panels at this point, helping people understand it from a state perspective, how to work through and manage these federal funds. And I'm really proud that Minnesota has built that capacity from the ground up on the fly as we try to figure out how to maximize the use of state funds by getting those federal funds and using them in our COVID response. So just really happy to continue and pick up where we're left off, Madam Chair. And with that, I'll turn it over to our budget director. Thank you.
Thank you, Commissioner. Appreciate that. And congratulations to you and your team for that thinking and that innovative work that you've done out of your agency there. So Ms. Rattan, Director Rattan, good morning.
Good morning, Chair. My name is Britta Rattan. I'm the State Budget Director. We got partway through this slide deck last week, and we left off right before we started talking about our refinancing strategy in December. So that's where I will pick up today. So the slide that you should be seeing on your screen is just an overview of our refinancing strategy that we did in December. I want to highlight that we did this as we were approaching what we thought at the time was the end of the CRF. The original end date on these funds was 12/30 of 2020. Right before the holidays, Congress did pass a bill that extended that end date. It was not signed by the president until I can't recall if it was the 26th or the 27th of December, but right after the holidays. And so this was all done in preparation for assuming that the funds were ending at the end of that month of 12/30/2020. So what we were doing at the time, we identified projected underspending in our existing coronavirus relief fund authorizations. So we looked at underspending in various categories of critical care supplies, testing, food security, temporary staffing, and in government operations. And what we did is we worked through the LAC process to reduce the authorizations in those areas where there were an underspending, and identified spending within the COVID Minnesota fund that would have been eligible as a CRF expenditure. So we worked through both the LAC and the LCRC to execute these moves of expenditures. Essentially, we moved expenditures from the COVID Minnesota fund to the coronavirus relief fund to make sure we were maximizing the use of the coronavirus relief fund as we approached that deadline. And so we identified in the COVID Minnesota fund about $45 million in spending that we could move to the coronavirus relief fund. And we reallocated those funds in December through that process where we worked through both the LAC and the LCRC to get those approvals. The other thing that's highlighted here on the slide is that we also are in the process of refinancing the Veterans Affairs General Fund appropriation with dollars that are coming back from local units of government. If you recall, there was language passed, I believe, in the October special session requiring that any funds returned from local units of government be used to reimburse a general fund appropriation that was eligible. And so as we finalize the number on the returned local funds, and as Amy Jorgensen can tell you, we are still reconciling those funds and getting some dollars in. So we don't have a final number yet, but it's just over $1 million. We will refinance a part of that Veterans Affairs appropriation that was made from the general fund, which essentially will then return the equivalent dollar amount of the returned local government funding to the general fund.
Director Rattan, before you continue on, just a couple questions.
Certainly.
Who was the, what were the folks that did the, who identified the projected underspending and determined whether they were going to, you know, if they were going to go to the COVID Minnesota Fund and you're going to do the refinancing? Who determined those projects is what I'm trying to say.
So with the CRF authorizations that had been made to date, MMB, both the budget team and Amy Jorgensen's team in the coronavirus accountability office had been meeting with the agencies or the work groups that we have set up in the SEOC to talk about their rate of spend and whether they thought they would fully use their allocation by 12/30. In the places where they were fairly certain they would not, we didn't want to leave those authorizations in place and lose that funding. And so we were working with them on almost a weekly basis to look at essentially their spend rate and where there was underspending, where we could reduce their authorization and then move previously incurred expenses from the COVID Minnesota Fund over to the Coronavirus Relief Fund to make sure we used those dollars.
Now, this allocation committee has been referenced in Senator Benson's committee before. Is that the same committee or is it different? And who is on that committee? And that's a pretty powerful committee to be determining what funds are going to be appropriated and refinanced. And can you tell me a little bit more about that?
Senator Rosen, I'm a little concerned. I think the allocation committee that was discussed in Senator Benson's committee was around vaccination use. What I'm talking about is just at a staff level, we were looking at where there were previous authorizations that were made through the LAC. So previously authorized spending where they weren't going to fully utilize the authorization. So where they were suggesting that they were approaching the end of the Coronavirus Relief Fund eligibility period, and they were not going to have fully expended the funds.
Madam Chair?
Yes, Commissioner.
Yeah, I would just confirm what Budget Director Breton just said. I checked in with the Health Department asking about this a phrase that was used in the previous committee. It was referring to the allocation of vaccines. As you know, there's the 1A, the 1B, the 1C, the allocation of who gets prioritization in the vaccine strategy. There's a public group that is consulting basically with the Department of Health, trying to think through all of those questions. That is the purpose of that committee that you're referring to. It has nothing to do with the financing strategy.
Thank you. And I'm a little surprised how, well, actually that the local government's only, you say there was about $1 million left that is being returned. Is that right, Budget Director?
Madam Chair, if Amy Jorgensen is on, I think she would have a more exact number because it's her office that is tracking that. And I know it changes over time as they're reconciling with local units. So if Amy Jorgensen's available, I would defer to her.
Yes, is Ms. Jorgensen on?
Yes, I'm here.
Thank you. Good morning.
Good morning, Chair. Good morning, members of the committee. My name is Amy Jorgensen, Director of the COVID-19 Response Accountability Office. So currently we have received just a slightly over $1 million back from the local governments. I will say we are still working with them to try to understand, spending at the city and town level. And if you'll recall, the way that the funds were rolled out is that if there were any unspent funds left at the city or town level, those had to roll up to the county, and then the county had to roll those back up to the state. And so we are finding that just a little bit challenging to make sure that at the city and town level, everything has been spent and has been rolled up to the counties. We're working with each county to make sure that that is occurring. We are still seeing where there is some underspending or unspent funds at the city and town level, and they are continuing to inform their counties that they have unspent money. So we're really trying to get a final number, soon, hopefully within the next couple of weeks. And so I would guess that, the number will end up being somewhere larger than $1 million, maybe a couple of 100,000 more than that. We're just not really sure at this point, but we are working through that with the local governments.
Mm-hmm. Kind of surprised that, it'll be interesting to see maybe a breakdown on that. How many counties gave their money to the hospitals if they couldn't use it all up internally, that they were able to give it to the hospitals. And hopefully all the counties know that that was an option. That's huge.
Yeah, so Chair Rosen, the hospital option was only available for local governments that were within Hennepin and Ramsey County, because Hennepin and Ramsey received their funding directly from the federal government. And we did put out a report mid-December that talked about dates or spending to date, and it was maybe a couple $100,000 that the localities within Hennepin and Ramsey had returned to hospitals, so it wasn't large. But there is some information in that last report that we put out about that.
Yeah, but Ms. Jorgensen, they also received money in the big pool too. They received 331 million, Hennepin and Ramsey, or Minneapolis and St. Paul, I should say. And then they were put back into the big pool too. So they received 2 doses of money. They received their federal funds directly, but then they were also, included in the big formula with all the other cities and counties.
Well, for the coronavirus relief fund, we did not include them in that formula. So when we allocated the $841 million out of the coronavirus relief fund that came directly to the state, Hennepin and Ramsey were not included in that.
Madam Chair, the localities within Hennepin and Ramsey though were, is that correct,
Yes.
Amy? So the cities within the county, but the county did not directly receive an allocation from the state.
Okay, thank you for that clarification. Thank you.
You're welcome.
Okay, who would like to continue? Director Rattan?
Certainly, but I think I just lost my slide deck and I don't know if Melissa's able to pull it back up. Thank you, Melissa. If you could turn to the next slide. So one thing I just wanted to highlight, Madam Chair, is that as we're moving expenditures from the COVID-19 Minnesota Fund to the CRF, we were really trying to make sure we were leaving dollars in the COVID Minnesota Fund where we thought we may be receiving at a future date federal reimbursement from FEMA. I just wanted to highlight here that a lot of our funding that we moved to the CRF was from previous critical care supply purchases. And what we were moving was the portion of funding that would represent the 25% state share. So we heard from the federal government that the CRF could be used to meet our 25% state share for FEMA. So essentially, as we moved FEMA eligible purchases to the CRF, we just moved 25% of that share so that the remaining 75% is in the COVID Minnesota Fund. And if we eventually do receive the FEMA reimbursement, those dollars can then cancel back to the general fund. Instead of, if we had moved all of it to the CRF, that FEMA reimbursement would have retained CRF characteristics and we couldn't have easily transferred it back to the general fund. And so through this process, we were trying to maximize places where federal funds could be reimbursed and where we could get money back to the general fund.
Director Rattan, we have a question. Senator Kiffmeyer.
Madam Chair, I can wait for a little bit because they're covering kind of the area that I want to talk about. So let's just wait.
Thank you. Director?
And then at the bottom part of the slide, you can see there were some purchases that were moved from the COVID Minnesota Fund to the CRF that we deemed to be not FEMA eligible, and therefore we just moved them at 100%. So not leaving any of the expenditure in the COVID Minnesota Fund because we were not anticipating a future FEMA reimbursement on that expenditure. But you can see critical care supplies was a big area where we assumed some FEMA reimbursement, as well as the unreimbursed testing costs from the Mayo and the U contract, the alternative care site, as well as the storage facility, which is one place where we have actually received the FEMA reimbursement now for the 75% share, and then the community engagement spending out of the COVID Minnesota Fund.
Okay.
Okay. And Melissa, if you can turn to the next slide. I'm going to need to figure out, there we go. So this is just a look at, through these actions, how we moved the balance in the CRF and the COVID Minnesota Fund. So essentially what we were doing was reducing allocations in the CRF to make sure we were reducing allocations in the places where they were not going to get the money spent by 12/30. And then moving to the CRF, the equivalent of about $45 million of spending out of the COVID Minnesota Fund. And in so doing, that freed up resources in the COVID Minnesota Fund. So you can see in the CRF that where it's shown that we canceled about 34 million in authorizations. There was also an existing authorization available for critical care supplies that wasn't fully utilized. So we moved 11.3 million of critical care supplies purchases to meet that previous authorization. And then also through the LAC process moved, LAC and LCRC process moved additional about 33.8 million from the COVID Minnesota Fund to the CRF. All of this was in an effort to bring that CRF balance down to zero. So we were fully utilizing it as we approached that end date of 12/30/2020. And then the COVID Minnesota Fund column shows that as we moved expenditures out of the COVID Minnesota Fund, so we moved from that fund expenditures that were previously incurred, that freed up resources in the COVID Minnesota Fund to the tune of about $45 million. Also within the COVID Minnesota Fund in January, we received the insurance reimbursement on the original testing contract with the U of M and Mayo. So that was about 19.5 million. We additionally, as I mentioned on the last slide, received the FEMA reimbursement for the cold storage building in the month of December. And then there were some authorizations in the COVID Minnesota Fund that were also not spending at the level that we had previously assumed. So we also pursued reducing those COVID Minnesota Fund authorizations to a level to match what was being spent. And that shows how we arrived at a balance in the COVID Minnesota Fund at the end of December, which was then allocated for testing and vaccination, as well as homelessness services of the 88.4 million.
Which Director Rattan would have gone into the general fund if this refinancing had not been implemented. I have two questions here. Senator Benson, are you ready?
Madam Chair, I think Senator Kiffmeyer was in line before I was, but at your pleasure. So I did want to ask the insurance reimbursement. So I believe the document that described the U of M and Mayo testing said that 60 or 70% of that money would be coming back. And so did we get close to that number? And secondly, is there any more that we anticipate coming in for insurance reimbursement? And then we should be getting more insurance reimbursement out of the vault contract. Are we going to get to that, or is that coming in another fund description?
And where does that money go? Right.
And where does it, how is it characterized? Yes,
So
when it comes back.
Director Raton.
Senator Benson, so the 19.5 million, I believe, is the extent to which we expect to receive reimbursement on that initial 36 million.
Okay.
You are correct that we will get additional insurance reimbursement from both the U of M and Mayo as we get into the phase 2 of the contract, and that was funded out of the CRF. So as those insurance reimbursements come back on the second round of that contract, that is, those will come back as CRF funds. So at that point in time, we will need to find expenditures that are eligible for CRF to direct to those dollars. And it can be prior expenditures. So we could go back to expenditures from the general fund and redirect them at those insurance reimbursement funds.
Senator Benson.
And Madam Chair, I want this committee to be aware that there will be backfill to the CRF, even if the feds aren't sending another pot of money there, that the administration will have control over. And so I'd say spend some time reviewing what the CRF was spent on to make sure that you can be supportive of those type of priorities going forward, because once again, we are not in a position to stop that spending unless the House of Representatives agrees with us. And so I just want to, we're going to keep having this federal funds out of control of the legislature issue going forward.
Senator Benson, have they given you any idea to how much they are sending for vaccinations and testing? Is there any idea what the feds are doing?
Madam Chair, I haven't seen any federal claims, but we did get a request for 40 million on the 29th of December through the LCRC. And I haven't seen any other, I haven't seen obviously a general fund request. And I know there was a direct request to the federal government, or I believe 87 million, might have been 97 million. I apologize for not knowing that off the top of my head, but I haven't seen a description of what that rollout would be, how many people we're hiring, how much we're paying for facilities, et cetera.
And I just do want to clarify that even in the CRF, even if the House agrees, we cannot stop the money.
Oh, thank you, Madam Chair.
Senator Kiffmeyer.
Thank you, Madam Chair. I think what matters to me most as a member of the Finance Committee is a real simple thing. The session law that was passed and established the COVID Minnesota Fund required that any money in the fund that remains unobligated on December 31st, 2020 cancels to the general fund. So Director Raton, can you tell me what amount of money canceled to the general fund as of December 31st, 2020? That's just one question I'd like to ask right now.
Thank you. Director Raton.
Madam Chair, Senator Kiffmeyer, we sought authorizations for the remainder of the balance in the COVID Minnesota Fund prior to the expiration date on the fund. And so those authorizations that were sent over on December 29th were for funding for testing, vaccination, and homelessness services that used the remaining balance of the fund. I want to highlight that we worked with our attorneys around the language in that session law that you cited, because it does not say that it does not use the word encumbrances. And so we talked about that the obligation is incurred at the time that we go through the LCRC process.
Senator Kiffmeyer.
So am I to gather from that, Director Raton, that there is $0 that canceled back to the general fund as of that date because of that obligated definition that MMB is using?
Director Raton.
Madam Chair, Senator Kiffmeyer, that's correct. I do want to highlight going forward that there will, as dollars come back through FEMA reimbursement, those will cancel back to the general fund. So at this time, there was nothing canceled back, but there will be as we receive the FEMA reimbursements back into the COVID Minnesota fund, which will offset the expenditures from that fund. So we do anticipate dollars canceling back in the future.
And
Senator Kiffmeyer?
yes, well, that I know that, Madam Chair, we have a budget to establish for the state of Minnesota for the next 2 years. And so it's very important to know these are millions of dollars, and it's very important for us to know what that amount is and what the date is that those will be canceled back to the general fund. And I think the expectation always was that with the amount of the federal money, that we would be seeing that 200 million coming back to the general fund. So at this point, it's zero. There's talk of the 25% FEMA match amount, but I would look forward to some sort of document that would give us a timeline of when and how much is anticipated in regards to canceling back to the general fund. That is a matter that is critically important to the legislature in establishing the budget. I think it's also really important to realize that I don't think ever before, Madam Chair, in the history of Minnesota, there are federal funds that have come in and they've been for specified purposes, like the CCDBG that goes into the child provider account. There's a variety of things like that, very specific purpose. This sort of thing, when you get billions of dollars like this, is very exceptional. And to bypass the legislature is not a good place to be. So with that, I would hope that the administration would recognize the importance of blending this into the entire next 2-year budget, because that's going to be important. It's important for the legislature, for the people of Minnesota. And so I'm hoping that we can see that. I would also like to know, maybe you could send a definition of the obligated again and how that was come to, so that if we have that understanding, we can be on the same page with the executive branch and your understanding. That definition is a little bit exceptional to my work here in finance. Thank you, Madam Chair.
Thank you, Senator Kiffmeyer. I definitely think we need to clarify the encumbered and obligated definition. Mr. Tan, after these FEMA reimbursements, how much do you anticipate canceling into the general fund, and will those be reflected in our February forecast too?
Madam Chair, to date, we have been reflecting the funds when we actually receive confirmation from FEMA that they will reimburse. FEMA is a little tricky, and it's hard to know how much we will actually receive back. So we have been hesitant to forecast a number that is too optimistic. So we have been waiting until we have confirmation from FEMA that an expenditure is reimbursable. Again, Amy Jorgensen from our Office of COVID Response and Accountability has been monitoring and assisting with the FEMA applications to date. So she can give, and I think there's even a slide in the deck in her section that gives more of an update on what we've pursued from FEMA thus far.
Okay, sure. Well, then we'll just wait for that answer at that time. I think Senator Benson, yes?
Yep, to this point, I think the legislative intent at the time we appropriated the general fund was that the money needed to be spent on things before the end of the year. We clearly did not communicate that firmly in the language, and so we're going to need to be more precise because without clearly communicating legislative intent, we now have contracts that are committed through June 30th to spend money that would have otherwise canceled back. So lesson learned, let's be more precise in our timeline.
Thank you, Senator Benson. And I before I turn it over to Senator Ingebrigtsen, and I do know, well, the LCRC has been clunky also, and the LAC process is even clunky, and the COVID challenge has definitely highlighted the shortcomings of the LAC process, which I might want to remind members, it is since 1979, the LAC process has been there. It has maybe been recodified, but nothing has changed in this. And it definitely has kept the legislature out of appropriating and having some authority, some say, some public opinion conveyed into how these funds have been spent. And I think that is something that we really do need to look at going forward. We don't know the path of this pandemic, but the path that we are on in this with the appropriations of these monies, this is not sustainable. Senator Ingebrigtsen.
Thank you. Thank you, Madam Chair. And that was a tremendous segue into how I received my first question. Obviously, the public's paying attention because I received a text from someone who would like to ask the question with regards to buying the warehouse for the to be utilized for the morgue. Ms. Rattan, I'd like to know what that has been used for, and I apologize if I don't know that it's been used for the intended purposes. And my second question is, you were talking about those dollars being used for, and I think it was vaccines for the homelessness. Is that what you said? Some of those dollars were used for homelessness. Could you elaborate a little more on that, please?
Director Rattan.
Madam Chair and Senator Ingebrigtsen, the warehouse, I don't know if we have anyone that joined this morning from the Department of Health. I think they could more accurately speak to how that warehouse has been used. I know at one point it was being readied for its intended purpose, but I don't know that we got to the point where it was needed for that purpose. And that warehouse was purchased at a time when, if you recall, there was frankly really unfortunate events happening in other states where people were being treated in ways that didn't feel like they were being honored and respected. And we wanted to make sure we had an insurance policy against that happening here in Minnesota. I also want to highlight that we did receive FEMA reimbursement on 75% of that purchase. So 75% of that purchase was covered through FEMA. But I would have to defer to the Department of Health to speak to whether we have used it for its intended purpose to date, because I am not sure of that. I know at one point we were getting very close.
Yeah. So thank you, Madam Chair. If I could follow up real quickly with a comment. Yes, I know the reason why. I know refrigerator trucks were being used in New York, and it was failing there, and it was a horrible, disgusting mess. And I understand the if it would have gotten to the point where we needed something like that, it would be considered, I guess, pretty good planning. However, if it has not been used and it's now sitting and being utilized for something else, I think we need to know that. And Madam Chair, I will follow up with the Department of Health and find out what that's used for and what the intended purposes are moving forward. So thank you.
Thank you, Senator Ingebrigtsen. And Senator Benson, you can chime in if you happen to know the answer. Anytime.
Madam Chair, last I saw it was being used for storage of millions of gowns and some saline. So not being used as a morgue. And if you recall, it was purchased at a time where our models were projecting massive amounts of death. But by the time that was completed, we knew the models were significantly off. And so I guess a good follow-up for Ms. Rattan, what happens when we sell the building? If it's FEMA reimbursed, where do the proceeds from the sale of that building go?
Director Rattan.
Senator Benson, Madam Chair, I don't know this with certainty, but I would assume we would need to reimburse FEMA in the portion of which, based on typically how federal funding works, based on the portion of their contribution.
Thank you. Senator Kent.
Sorry. Thank you, Madam Chair. And Senator Benson really got at my question. So
thank you. You bet. Okay, no further questions, looks like. So please continue, Director Rattan.
Certainly. And Melissa, if you'll pull the deck back up, thank you.
Madam Chair, if I could just make one comment as we bring the deck back up.
Mm-hmm.
Madam Chair, I just wanted to be clear to the committee that all of the activity going on right now, for vaccination and all the activity going for testing and helping teachers get back into school is funded by those $40 million approvals of the LCRC that we were talking about before. So just remember that the activity that you're seeing right now is literally tied to the approvals and the money that the budget director is talking about. So that's enabled the state to sustain its effort even as we were unsure about the availability of federal funds or the availability of any funds for the months of January and going into February. So it's just been an incredibly important lifeline, and I appreciate the LCRC accepting that request, approving it. It's because that has enabled Minnesota to continue doing the kind of work that I think we all want to see, of vaccinating people, getting that vaccine out into arms as fast as possible. And without it, we would have a crisis, I think, in funding and trying to figure out how to get that activity going.
Commissioner, I don't know if you can answer this, and perhaps this is a question for Senator Benson's committee, but how long is that amount of money going to be able to extend into? How much more money do you need, or how much time do we have on that 40 million?
Madam Chair, that's a great question. The budget director and I and the Department of Health are scrambling to try to figure that out right now. We know that obviously there's additional federal funds coming with that second stimulus bill, but we're trying to get better estimates to understand the interplay of different factors so we can give you some better information for everyone.
And I would assume you don't know if that goes directly to you, if it goes into a pool. I mean, you have probably no idea of how those funds are going to be appropriated.
We have some work to do, yes.
And Madam Chair, if I could, to that point, that was why my question yesterday about insurance reimbursement at some of these sites, because the feds are reimbursing for 2-shot, and they are reimbursing at facilities that can bill to Medicare, and they just increased the reimbursement for Medicaid, which is why we will stretch those vaccine dollars much more if we focus on, if we're getting to populations 65 plus are Medicare eligible. So if we want to stretch the dollars, let's make sure we're getting insurance reimbursement for those vaccinations. It will help sustain us longer.
Very good. Thank you.
Madam Chair. Madam Chair, real quickly, I didn't get my answer from Dr. Bertan with regards to the comment of homelessness, and I didn't. I need to wrap my head around that if I could, real quickly, before you move on.
Absolutely. My apologies, Senator Ingebrigtsen. Director McCann.
Certainly, and my apologies to Senator Ingebrigtsen. That funding is not for vaccination. It is for isolation space and making sure there is enough isolation space to serve the homeless population so they are not in more tightly packed congregate settings over the winter months where COVID-19 would spread more rapidly. And this was funding there was original general fund appropriation for this purpose back in March. It was sustained with CRF funded appropriations through December. And so the goal there was to try to continue it through the winter months so that we didn't have a problem arising with that population in January and February.
And real quickly, do you know how much that was? I'm sorry.
It was just under $9 million.
Out of the Minnesota fund, correct? Mr. Tim, okay.
Thank you.
Yes.
Okay. No further questions. We'll continue on. Director Raton.
Thank you. I think that covers this slide. So Melissa, if you could move to the next. At this point, Senator Rosen, I will pass it to Amy Jorgensen with our COVID Response and Accountability Office to just talk about some of the complexities and reporting pieces of the CRF.
Thank you. Ms. Jorgensen.
Thank you, Chair Rosen. So just want to talk quickly about the deadline for the use of CRF funds. As we all know, this was kind of a moving target. Originally, the funds, when the Treasury instructions came out, the funds had to all be spent by December 30th. Treasury then amended that to say that the states and localities had to incur costs before December 30th, 2020. But then right before that deadline happened at the federal level, they extended that deadline to December 31st, 2021. So actually gave us a whole extra year and a day to spend those funds. And so back in December, after we learned that this was going to be taking place, MMB submitted a request to extend the spending authority for 28 previous LAC authorizations past December 30th, 2020. I believe we have some that expire in January of 2021, some in June, and then some in December, depending on the type of expenditure it was. And then for any of those LAC authorizations that did end December 30th, 2020, we are working to identify and capture any underspending of those appropriations or those allotments. And then we will figure out then what the balance of those are. Just for a little bit of clarification, for CRF funds, the U.S. Treasury generally expects costs to be paid within 90 days after the deadline. So now that the deadline has been extended to December 31st, 2021, we anticipate that we will be continuing to pay costs through the remainder of the calendar year, and then a final report of CRF fund expenditures will be due sometime in 2022. We don't have that final schedule from Treasury yet.
Ms. Jorgensen, did you, I know there was a request from the cities and towns to allow an extension on their deadline also, and that was denied. Now that you know that this was extended another year, do you wish you'd allow these cities and towns to have had a little more time in the counties? And will we be able to, I think it's really important that they utilized all their funds and had the opportunity to utilize them now that this pandemic is extending on perhaps longer than we all realized it was going to.
So Chair Rosen, as I said, by the time we figured out that the deadline was going to be extended to December 31st, 2021, the local government's deadline had far passed. Their deadlines were November 15th and then December 1st. But I think as we have seen, based on the very small amount that came back from the local governments, as of to date, about $1 million out of the 841 million that was allocated. I do believe that the local governments did do a good job of spending those funds. Very little came back. And so I do believe that they were able to utilize those funds as they intended.
Okay. And how did you decide which ones to extend? How did you decide which ones to extend them?
Chair Rosen and members, so you're talking about the 28 LAC authorizations that we extended past December 30th. I'll ask Britta Rattan to also speak to this, but I believe what we were looking at there were expenditures that were directly related to the response, such as testing, not vaccination, but testing and other, possibly some other homeless appropriations where we knew that we were still going to have a need. So Director Rattan, if you want to speak to that.
Madam Chair, Ms. Jorgensen is correct. We were really trying to focus on those places where we knew that the need was continuing and they were facing a cliff going into January 1. So we really weren't extending things like operating dollars because the expectation was that those agencies could find a way to make sure that that spending occurred before the end of the year. So we were trying to focus those extensions on the more direct public health response efforts.
Thank you. Ms. Jorgensen?
Okay, next slide, please, Melissa. Briefly, I want to talk about what happens if there are disallowed costs. So last Thursday, when I was speaking with you, we talked a little bit about audit responsibilities for the CRF and how that will work. So right now there are audits that are going on both at the state level. So the Office of the State Auditor is reviewing the Coronavirus Relief Fund expenditures at the state level. They are also reviewing expenditures at the local government level as well as other CPA firms. And then we have submitted pretty detailed information also to the U.S. Treasury on expenditures. And so we've got several eyes looking at the way that we've spent the funds. And if anything is disallowed, the U.S. Treasury can either seek recoupment of those funds or allow the states to demonstrate that there are other eligible expenses that were incurred that would qualify for CRF. And we can appeal any determination of a disallowed cost. So there's kind of a couple of levels going on here when there are, if there are disallowed costs that are identified at the local level, as part of our subrecipient monitoring responsibilities at MMB, we'll be taking a look at those to see, if we agree and what's going to happen with those. But then if there are any disallowed costs that are identified at the state level, then the Treasury will be reviewing those and seeking either recoupment or allowing us to do other costs.
So Ms. Jurgensen, then if at the state level, would that be a general fund expenditure? And at the local level, would they be obligated to pay that out of their budget?
So Senator Rosen, I believe that we would try as much as we can, I think, to try to figure out how to rebalance that within the coronavirus relief fund, if at all possible. I don't know that it would be a general fund expenditure because it would just be a disallowance. So I'm not sure exactly if we've thought that all the way through yet, but I do believe that they're going to be fairly lenient in allowing us to substitute other expenses within the CRF.
So you're going to have to allow some slush fund in the CRF, just in case, basically. And what about at the local level?
At the local level, when we asked the local governments to, they signed a certification form with us before we allowed the funds to go out, and they understand that they're responsible for repayment of any disallowed cost. So it would have to come out of their funds.
Okay, Senator Marty.
Madam Chair, just a real quick question on that. When are we going to know what we owe the feds, if anything? I see how much effort is going into preventing us from losing money back, but when will we know?
Ms. Jurgensen.
Madam Chair, Senator Marty, the Office of the State Auditor will complete their audit for the state level for fiscal year 2020, probably sometime in March of this year. So we will have a pretty good idea if there are disallowed costs at that point. And then as far as the local governments go, those audits are due in September of 2020. And so we will know then later on in this calendar year if there are disallowed costs at the local level.
Senator Marty.
Madam Chair, yes, when we're dealing with these huge amounts of money and a lot of effort, and I see how difficult it is to try and make sure we're not losing money back. I was just curious. It looks like we may not end up paying anything or very little back, but it would be helpful to know when. But so that's helpful answer. Thanks.
Thank you, Senator Marty. Senator Kiffmeyer.
Thank you, Madam Chair. So I have a question in regards to it says the Office of the State Auditors reviewing costs. Obviously, when you say reviewing costs, is that the same thing as an audit? And it's a little puzzling to use the state auditor in this way. Could you explain a little bit more about what reviewing costs submitted to ensure compliance means? Is that an audit or is that something else?
Ms. Jurgensen.
Thank you, Madam Chair, Senator Kiffmeyer. So the Legislative Auditor's Office would normally do what is called the single audit of the coronavirus relief funds because they are federal funds. And they let us know earlier last year that they were not going to be doing the audit of the coronavirus relief funds. And so then we contracted with the state auditor to do that. So yes, it is an audit. It's the single audit. It's the same type of audit that the OLA would be doing of other federal funds. So when I say review costs, we should have been more clear on that. They actually are conducting the single audit of the coronavirus relief fund and will do the audit in compliance with uniform grant guidance.
To follow, Madam Chair.
Right. Mm-hmm.
So, Ms. Jorgensen, in regards to that, the single audit is normally and customarily done on an annual basis. CRF funds are not a regular expenditure. So are you mixing those two together and using the state auditor for both of those? I can't really tell from this because you use the words single audit, but in the slide I have, it's CRF. So I'm confused as to what you're referring to.
Jurgensen.
Okay, Madam Chair, Senator Kiffmeyer. So the coronavirus relief fund, as we know, will cover 2 fiscal years. It will cover fiscal year 2020 and then also fiscal year 2021. And I guess now that they've extended the timeline, it'll actually go into fiscal 22 as well, actually into 23. And so we have contracted with the state auditor to do the single audit of the coronavirus relief funds for fiscal 20 and for fiscal 21. And so they will be looking at all the expenditures throughout. And so we've kind of carved off that part of the single audit since the Legislative Auditor's Office said they would not be able to do that. And so the state auditor is doing the same type of audit that the OLA would be doing specifically on the coronavirus relief funds.
So Ms. Jorgensen, Madam Chair.
Senator Kittmeyer.
Okay. So Ms. Jorgensen, has the state auditor received some coronavirus funds to assist her office beyond the contracting money?
Ms. Jorgensen.
Senator Rosen and Senator Kiffmeyer, we contracted with the state auditor's office, and we did do an LAC request for the costs out of the coronavirus relief fund for both fiscal 20 and fiscal 21 audits. So they just received, they didn't receive any money outside of the coronavirus relief fund, but they did receive money for both years out of the coronavirus relief fund to conduct those audits as is allowed.
Madam Chair. Yeah, I'll just follow up with that. So I'll be meeting with the auditor later, but I am still finding that you're conflating the two. The single audit, what the Legislative Audit Commission approved in a unanimous vote bipartisanly, was to support the legislative auditor to, since he's not committed by statute or any way or purpose, and by the way, the federal government in regards to the single audit already provides money for that to every one of these agencies. So that single audit is already being covered by the federal funds, having nothing to do with the CRF situation. So I'm not real comfortable because you're mixing those two, and I think they need to be separated because they are covered in a very different way. And so I will be doing a little more work on that, and I will also talk to the state auditor. So I'll be getting a better handle of that, but it bothers me that you're using those two joined together. But Madam Chair, I'd just like to let this go on for now, and I'll follow up in more detail. Thank you.
Thank you, Senator Kiffmeyer. Ms. Jorgensen, any thoughts?
Chair Rosen, I would just like to say that maybe this will help clarify a little bit. The overall single audit will be conducted by the Legislative Auditor's Office. There is one tiny piece of the single audit that will be conducted by the State Auditor's Office, which is the CRF program. So similar to when Minnesota State Minnesota State is also part of our single audit, but they have another auditor who conducts their audits outside of the Legislative Auditor's Office to cover things like their federal financial aid and things like that. All of the work of that auditor, plus the Legislative Auditor's Office, plus the State Auditor's Office, that will be combined together for the overall single audit. This is just one slice of the pie for the single audit for this for fiscal year 2020.
Madam Chair, just a bit of information. I serve on the LAC, so I get really in this. So the last single audit the Legislative Auditor's Office will do is the one that's released in March. And then after that, it's going to have a different thing. And I just want to really put on the record the importance in auditing of having an outside entity audit. We worked heavily with the legislative auditor and understanding that separation of duties and how important it is. So the state auditor audits local governments, that is their purview, so on. And so, yeah, they do auditing, but I'm not convinced that this really meets the auditing level of an outside entity. And so that's just a different policy issue, and I think needs to be considered as well. But I want to complete the understanding that the single audit by the legislative auditor, the last one is this March. Thank you.
Thank you, Senator Kiffmeyer. Okay, who would like to continue? Ms. Jorgensen, are you on this?
Yes, thank you, Madam Chair. Next slide, please, Melissa. All right, so my last slide that I want to talk about is FEMA, which we've already had some conversation about. Just up to date, we have submitted about 30 projects to FEMA, totaling about 30.5 million in costs. And actually, just today, I received an update that we're a little over 31 million now with another project. Of this amount, about 23 million is anticipated to be reimbursed. And of that amount, FEMA has already agreed to pay 9.5 million, which includes the amount that we received for the storage building, the 4.some million. Our big players right now who are submitting FEMA projects are the Department of Health is definitely our biggest player, and then the Department of Human Services is also coming up behind. The types of projects that we're reimbursing for are things like critical care supplies, testing, Had some media campaign costs in there, as well as BiPAP machines and things like that. And so the people at the Department of Health and the Department of Human Services, as well as a couple other agencies, are working really diligently to identify costs as they are paid and ready to become FEMA reimbursable, and then submitting those projects to FEMA. We run a weekly meeting just to kind of keep up to date on what's happening in the agencies and answer questions. We work really closely with the Department of Public Safety in order to submit those projects to FEMA.
And once again, that will be reflected in the February forecast, Ms. Jefferson? These funds that are coming back in?
I will ask Director Rattan to speak to that.
Director Rattan?
Madam Chair, where we know we are receiving reimbursement, yes. Where we are waiting on a determination from FEMA, we will have some more internal discussion, but to date, we have not been counting those because there is some uncertainty about what FEMA will and will not reimburse.
And those funds will go back into the general fund, not into the CRF, correct?
Madam Chair, it depends on what fund the expense originated from. So if it came from the COVID Minnesota Fund, it will go back to the general fund. If it was an original CRF expenditure that we're seeking FEMA reimbursement on, it is required to go back as a CRF dollar. And then we would need to work with the legislature to reallocate it. And again, one of the options for reallocating those dollars would be to point it towards a general fund expenditure previously, which would then ultimately get it to the general fund.
It would be really nice to get that 200 million paid off, reimbursed. I'm just saying. Okay, thank you. Let's see, I think Senator Kent was first, and then Senator Franzen.
Thank you, Madam Chair. And this reminds me of the conversation we had last week. I think it is important to recognize, the journey this has been and the intent that we all had based on what we knew at the time. And, when I heard Director Rattan talk about that what we were trying to do was maximize our opportunities for FEMA reimbursement and to then make sure that we were not leaving funds in a way that they would end up being returned to the federal treasury because we wanted those funds available to help Minnesota. That is exactly the intent. And this, the nature of the limitations of all these different funding mechanisms makes it challenging. But what was just described was what was very much anticipated, that we knew there were, and this, the refinancing through the COVID Minnesota Fund, that was sort of, I think, a realization later in the process. But again, it is about making sure that we have the resources we need and that we're able to ultimately really get them back into the general fund, whether it's a direct reimbursement or if it's a matter of utilizing them for something we would have spent general funds on anyway. But that has been a consistent theme throughout all of these conversations going back to the spring. And so I just want to acknowledge that we're still holding hands on this journey, and obviously we want to be accountable and transparent. But what I heard today is a real effort to deliver on what the intent was of those original processes and agreements.
I absolutely agree with you, and I think it's really important that this committee, especially this committee, understand the refinancing, the thought pattern, but also and how this all transpired. We still have an $882 million deficit this upcoming biennium that we have to solve. But you're spot on. But I also want to make sure that the department knows how important it is that the legislature too has some buy-in on this beyond just the Minnesota COVID Fund. So there's a few clunkers here, and we're just getting it aired out. But I do appreciate you summarizing that very well, Senator Franzen.
Okay, well.
Okay, now we can. Okay, there you go.
So my question is also kind of on the theme of evolving and clunkers. I have to say, you were mentioning the facility that we had for storage that was intended for one purpose, but as we evolve, we're using it for a different purpose. In this case, I heard it was for sailing and gowns. I've gotten calls from constituents who are concerned about that too, in terms of they were, some of them are spreading misinformation that we have vaccines stored in some warehouse. So I just want to get the record straight, so I can go back to constituents so they won't spread misinformation. It's very dangerous. So that's one thing, and maybe in the spirit of evolving, maybe that facility could also.
Senator Franzen, you can't. Yeah.
No.
Yeah. Thank you. Better. Nope. You're trying. You're trying.
I'm trying.
Yes,
My
you are.
buttons are not good right now.
It's not good. Take your time.
There we go. I think I just put it back on my computer. There we go. So just to know if there is some thought about using that facility for potentially vaccine distribution, or in a case we do get a lot of vaccine available, that it could be used for storage. But so we can clear the record. I just want to hear from someone who can say with determination of what we're using the facility for, and maybe this is more of a conversation for DHS. Maybe Senator Benson can answer it, but I just want to make sure we have the correct information of what the facility is being used for, and if we are able to repurpose it, can we still have that FEMA reimbursement stay intact? That's another question.
Very good. Who would like to take this question? Senator Benson or Commissioner?
If the commissioner wants to take a shot, I will defer to him, but we can follow up with MDH as well. So go ahead, Commissioner.
Madam Chair, Senator, I would also be happy to defer to you. I just didn't want to leave the comment unresponded to, because ultimately we'll make sure that the Department of Health talks to it. But I can tell you with certainty that the cold storage facility is not being used to hold vaccine. It was being used to hold some other items. We're happy it is not holding bodies. That is in fact the entire purpose of our effort, is so that cold storage facility is not holding dead people, and we're happy for that. The purpose of that building and the possibility of it holding vaccines in the future is also extremely unlikely. Our entire operation is intended to make sure that when we get allocations from the federal government, it moves from whatever distribution method, whether it's plane or truck, into arms as fast as possible. So we do not want to warehouse vaccine. We want to make sure that it is moving from allocation to Minnesota. The problem right now is not that there's too much vaccine and we have to store it. The problem is that there's only 60,000 doses coming into the state on a weekly basis. And as the Finance Committee members know better than anybody, there's more than 5 million people in the state. So we are not storing vaccine. We will use every one of those doses and get it out there as fast as possible. The challenge is that getting that distribution network put together and operating efficiently at scale is what's being set up. And ideally, we'll have more than 60,000 doses in the future so that it can actually help more people faster.
Thank you, Commissioner. Senator Benson.
Madam Chair, just to clarify, the facility cold storage doesn't have the medical tolerance refrigeration that's necessary, so it would have to be retrofitted. That would be an investment. I don't think a wise investment based on how fast we need to get vaccine out. Vaccines right now are being drop shipped to a location with appropriate storage and then couriered as needed when reconstituted if it needs to be distributed to a spoke from the hub. So I don't think the building's appropriate to be used for vaccine, and I hope that we can quell that now. The commissioner and I are in agreement, so everybody put a star on your calendar.
Thank you, Senator Benson. You had a great committee hearing yesterday about this. I think there was some confusion how the vaccinations are getting rolled out, and that was a very good hearing. So, Senator Kiffmeyer.
Thank you, Madam Chair. I think this discussion is such a valuable opportunity for the people of Minnesota. There is something so unique about the legislature and how it functions that we are able to get out accurate information. But part of that is getting accurate information. And it's so valuable that we are able to hear it at the same time. But I think I heard the word dangerous used in the context of constituents asking questions. I think it is very helpful when constituents ask questions and show that they are paying attention, they want to learn, they want to know, and they're going to have things are rolling out there always, but using their free speech to be able to speak to the issues or ask questions is never a dangerous thing for them to do. We should respect them and understand that they're asking questions as they have the right to do. And we have the responsibility to help them get those answers. And so just wanted to address that issue and also speak to the value of the legislature and the role that we play in the government. Thank you.
Thank
Madam
you.
Chair, can I respond to that? I hate taking the bait, but I want to be clear about my comments of if we spread bad information, which can be potentially dangerous because people don't have the right ability to know where to get the vaccine and whether it's stored or not. I'm just trying to make the point that we need to be clear on the information that we're spreading. So I want to have the right information because it'd be dangerous if I spread the wrong information. It would be dangerous. So just for the record, I'm not calling my constituents dangerous or their comments dangerous. That's why they have the direct line to my phone and they call me with these questions. Thank you.
Thank you, Senator Franzen.
And Madam Chair, I just want to clarify that that's exactly what I was saying, the importance and the value of having these committee hearings and to be able to ask those questions and to get those answers. That's exactly the point of it. People are sensitive out there. And right now, I think it's very important in the words that we choose and the context that we have. And I think it's very important that they not be deterred from asking those questions if it is mischaracterized. But I think that wasn't your intent, nor was it mine to say that at all, but to see the value of our committee hearings, to get that information. Thank you.
Thank you, Senator Kiffler. Ms. Jorgensen, would you like to continue?
Thanks, Chair Rosen. I believe I'm done with my slides at this point, and I will turn it back over to Director Rattan to close us out.
Thank you. I appreciate your help on this. Director Rattan.
Thank you, Senator Rosen. We wanted to just close this conversation talking about the December package that was passed by Congress and signed by the President at the end of December. As was mentioned earlier in the hearing, we are still in the learning phase around a lot of these dollars, but we want to give you the information that we have to date. And so a lot of these allocation estimates are based on analysis from FFIS. It's Federal Funds Information for the States, which is a national group that provides analysis to state governments as federal legislation is passed, so we understand what we might receive at the state level. So many of these dollar amounts are not based on actual awards yet from the federal government, but instead that initial analysis from FFIS. So I just want to talk through quickly what we think is likely to come. And again, all of these numbers are subject to change as we actually receive awards from the federal government. We are anticipating significant additional resources through the GEAR and ESSER funds as they are known. It's the Governor's Emergency Education Relief Fund and the Elementary and Secondary Education Relief Fund, as well as funding to Head Start. You can see the dollar amounts listed there. It's a significant increase in that ESSER funding compared to what was sent out to local school districts and charter schools earlier through the CARES Act. One item that I really want to mention on this education funding is that there is a maintenance of effort requirement associated with receiving the education funds, and it's different than the maintenance of effort requirement that they had in place for the first round of the CARES Act. It requires that the state maintain effort in terms of this percentage of education spending as a percentage of the total budget. It's actually a problematic requirement for the state of Minnesota because even though our dollar amount spent on education grows year over year, as a percentage of our general fund budget, our percentage spent on education has been declining year over year. We are hoping we can seek a waiver from the federal government to make sure this isn't a problem. I think the percentage requirement was actually put in place assuming that it was more helpful to states who might be cutting their budgets during a time of constrained resources, when actually it's problematic for the state of Minnesota, even as our education funding is growing year over year. My hope is that the Department of Education will see that our actual dollars of growth year over year is enough to meet a maintenance of effort requirement.
So Director Chen, has that waiver been formalized? When do you put it in? No? Okay. Also, can you, when you're going through this, can you explain which funds have go just directly to MDE or the higher ed? And
yes, thank you for asking that question. So that,
Madam Chair, if I could, to that point, with the maintenance of effort, thank you for disclosing that up front. At some point, I'd like Mr. Nauman, if not in this, but to write us a note, an explanation. For example, the enhanced FMAP resulted in a surplus. And so how is all of these moving levers, if we have a maintenance of effort requirement, how far off are we for this maintenance of effort? So not for today, I don't need an answer. We are short on time, but following up would be very helpful.
yeah, Senator Benson, we're definitely going to be peeling this apart a little bit more.
Madam Chair, I can just
Mr. Nauman.
I can just respond quickly. We have done a quick analysis. If you give me 5 minutes, I can give you a quick sense based on forecast numbers of where we're at on that MOE requirement.
Thanks.
Yes, please, Mr. Nauman, if you'd like to.
He said he needs five minutes.
Madam Chair, I just need to dig up the spreadsheet. It's buried on my hard drive, so just give me a quick moment.
Okay. When you're ready,
you can proceed, and I'll come back to it.
I think we'll do that. Director Tan, thank you.
Thank you, Senator. So for the education funds, the GEAR funding, the Governor's Emergency Education Relief Funds, come directly to MDE. The ESSER funds go to MDE. 10% of it is flexible funding to be determined at the state level how we spend it. The remaining 90% goes directly out to school districts on a formula basis. Head Start money, I apologize, I don't know exactly how that flows, but my assumption is it flows just through MDE, but goes out on a formula.
And what is that? What is the formula basis? Well, maybe we could get into this more later, but what is the formula?
For ESSER?
Yes.
And I won't be able to speak to it in the level of detail that the Department of Education could, but my understanding is it's based on the Title I formula.
Okay, thank you.
Mm-hmm.
Okay, Mr. Nauman.
Madam Chair, I was just agreeing. I think that's what.
I thought you were ready to talk. Okay.
Yeah, I think I've got it. It looks to me now there's some definitional issues, Madam Chair, in response to Senator Benson's question. It looks like so it's calculated based on the average of 17, 18, and 19, and in education you can use what are called entitlements, which is how much the formula generates. And one school of thought is that you could use the sum of the general education, special education entitlements. That's about a 38% number if you use the average for 18-19. So it represents 38% of general fund spending. It drops to 38.6% or 36.8%. And I can generate in just a few moments the dollar difference. If you use appropriations, and again, take the average for 17, 18, 19, that's about 41.7% of general fund appropriations. But then the FY22 forecasted level is about 40.2% of the general fund. So you can see that even in that analysis, it goes down. Then an alternate, yet a third analysis that the education staff in the Senate have looked at is just using all aid entitlements, again, not appropriations, but all aid entitlements. That number is about 41.6%. and the 22 number is 40.1. So again, what I would encourage members to think about here is there's lots of different ways to slice this analysis, and the guidance has not yet been clarified at the federal level. So the numbers that we might produce off of these various analyses are going to differ depending on what we hear as the guidance becomes clearer. But I think I would finally conclude by saying in all particulars where we are agreeing with the Department of Management and Budget that it looks like the quick analysis implies that we aren't going to meet the MOE under the forecasted levels.
Clear as mud. Thank you, Mr. Nauman.
Sorry.
It was a joke. All right, Director Ratan.
Thank you, Senator Rosen, and thank you, Eric. That was actually very, very helpful, and we landed at the same place, but you had far more details, so I appreciate it. The next box on the chart represents funding to higher education. Again, these dollars, frankly, are really uncertain at this time. I don't think actual awards have been made to institutions of higher education in Minnesota, but this is an estimate of how much funding may flow to Minnesota institutions by FFIS. The rental assistance funding would go to the Minnesota Housing Finance Agency to pay for rental assistance, but a portion of that is sent directly to local units of government. I believe it's over 200,000. And so what we are hearing currently from the Housing Finance Agency is that they are receiving 289 million of that total to be distributed.
So 200,000 goes to the local governments?
For local governments, over 200,000.
Over 200,000. Okay, thank you.
Right, and so the pot that goes to MHFA is really what would be used to distribute rental assistance to all those localities under 200,000.
Thank you.
Mm-hmm. And certainly the Minnesota Housing Finance Agency can speak in much more detail about that funding. It looks like there's some questions. Would you like me to pause, Senator Rosen?
Oh, I'm sorry, I missed them. Yes, Senator Kiffmeyer.
Thank you, Madam Chair. The question that I have on the rental assistance kind of brings up a question in general. Is it presumed that all of this funding is expended and unexpended goes back to the federal government? I suspect that may be pretty obvious, but I wanted to ask the question.
Director Ratan.
Senator Kiffmeyer, if I'm understanding, yes. So for example, in the budget that comes out from next week, we will show an assumption that we are fully allocating the federal resources that are coming to the state, and we will show our current estimate of the resources we're receiving. But anything that we do not spend of the federal resources would need to be returned.
Senator Kiffmeyer.
Thank you, Madam Chair. It answers that question.
And Senator Pratt.
Thank you, Madam Chair. Just two quick questions. One, the $1 billion is coming for unemployment insurance. Is that strictly to cover the federally promised benefits, or will that also be able to be used for operations and benefits that come from the state?
Director Ratan.
Senator Pratt, I don't have enough detail on that, but I think it is that estimate is coming from FFIS. And so that is my assumption on that estimate is that it's the federally promised benefits, but I would defer to Deed to provide more info about how the funds can be used.
Senator Pratt.
Thank you, Madam Chair. And then just to follow up on Senator Kiffmeyer's question on housing, anecdotally, I've heard from some of our landlords that the eviction notice or the eviction moratorium in the executive order, they are not collecting rents, and it's not based on lack of assistance necessarily to the renter. They're not applying for it. Will this be going to the landlords, or will this be going to the renters? And how will we be able to ensure that it's being used for the proper purpose?
Director Ratan.
Again, Senator Pratt, I don't want to go too far into the details of the allocations of the funds because I know MHFA is working through that right now. So I would defer to Housing Finance Agency. I apologize.
Well, we'll definitely
Thank you.
keep pulling apart more. Thank you, Senator Pratt. Okay, Director Atan.
Thank you. And Melissa, if you'll pull the slide deck back up. The next box on the chart shows the vaccine and testing money that is going to the Department of Health. So the assumption of vaccine funding is just a little over $50 million. Testing funding is at $324 million. My understanding is that these awards are now made to the Department of Health, and they are working through a plan for spending, and we'll be briefing the legislature in the coming days on how they would suggest these funds be used. In the area of human services, there's 137 million that is assumed to be coming for CCDBG, as well as a number of other smaller grants. My understanding is for the most part, these are rather formulaic and not as flexible, but therefore substance abuse prevention, mental health block grants, and foster care. In the area of transportation, the Met Council is anticipating about 186.6 million, and MnDOT is anticipating about nearly 214 million from the federal bill. And then again, the unemployment insurance amount is listed there for what is assumed to come to Minnesota. We also have a box for broadband. At this point, we're not hearing that any of the broadband dollars will be directly awarded to states, but wanted to make sure folks were aware that there's about $7 billion to support broadband in the federal bill, but I believe that spending will happen at the federal level.
Director Atan, what is the 213 million for MnDOT? What would that be for?
That is for roads, and I believe that is also somewhat formulaic in how that funding is distributed. MnDOT is currently analyzing the funds and could provide you an overview of how it will be allocated.
Madam Chair.
There's a lot in this slide. Yes, Senator Kiffmeyer.
Thank you, Madam Chair. I'm a little bit puzzled because the Met Council specifically gets almost as much money as MnDOT. MnDOT is a statewide entity that deals with all of it, which actually includes roads that might be in the Met Council area. But I'm really puzzled by that, and I think we do need a great more amount of detail to be sure. I think my concern here is that rural Minnesota, so Met Council is in the Twin Cities, roughly, just for people watching, it's in that Met Council area, but MnDOT is statewide. And so I can see something happening that I just want to be concerned here about rural Minnesota getting a fair share at this very large amount of money for their needs as well. Thank you, Madam Chair.
Thank you, Senator Kiffmeyer. Senator Marty.
Thank you, Madam Chair. Just a quick question. I was assuming that on that chart, they all said estimated amounts and they're all very precise. And then you got to the broadband box and say, well, we're not sure any's coming to the states directly. How certainly are those numbers pretty firm for everything else? Or is that just could be twice as much or a third as much? Or
Director Atan?
Senator Marty, the estimates that are on that slide are calculated by federal funds information for the states. And so they provide estimated calculations based on the formulas that are in the bill. Again, they have national data. So if something is based on population or various other factors, they do the analysis for the states. So we have a sense of what we might be getting. That's why they look precise, because they generate that with their data. As an example, MHFA ended up getting more than they thought they were going to get at the state level based on the FFIS analysis. And they are looking into that right now to determine, did some other state not certify? Was there some reason that the pot that was allocated was slightly larger? And so what we actually get in an award doesn't always match what FFIS calculates from their formulas, because there are other factors that sometimes a state doesn't claim the funds, or other factors that could drive something different.
Senator Marty?
So Madam Chair, in most cases, that will be the number, but it's, when you say estimated, it's because some of them could have other factors come in later and could probably in those cases knock it down slightly, but not likely increase.
Director Ratten?
Senator Marty, I think that's fair. What essentially we wouldn't call it a final number until we've gotten an award letter, so we know what we've actually been awarded by the federal government. As you might imagine, when these bills get passed, states are scrambling to try to understand what they might receive. And so this organization, FFIS, does this analysis on our behalf, running the formulas that are in the bill based on their data. And the data that the federal government uses could be slightly different.
Thank you, Madam Chair.
Mm-hmm.
Thank you. Senator Kiffmeyer?
Thank you, Madam Chair. Director Rattan, I think one of the things that I also have a question about, just like broadband, there's billions of dollars there coming more from the federal government. I know we have to wait for more information there, but the other boxes are estimates from FFIS to the states. Is there other money in that category that will be spent by the federal government that might affect our state, but is not under the control of the states, like what we've given here from FFIS? Could you address that, quote, other federal money in addition to broadband?
Director Ratten?
Senator Kiffmeyer, I don't have details on that because we haven't spent as much time digging in. The reason we listed broadband there is because when we saw broadband specified in the bill, we thought we may be getting money directly at the state level, and I thought others may have the same assumption. So we wanted to provide information that there is money for broadband, but as of right now, we're not hearing that it's coming to states directly. But I apologize, I can't speak to the other dollars in the bill that will be spent directly at the federal level.
Okay, thank you. Thank you, Madam Chair. I really appreciate that, but I think it's important for us as a finance committee, as we do all funds budgets on occasion, so we know what the federal government's impact of spending is in the state, not just our state money. And this to me is kind of a similar situation where there may be a federal funds not through FFIS to the state, but will have an impact in the all funds. Could we expect to maybe see it somewhere in the all funds category eventually?
Director Ratten?
Senator Kiffmeyer, it would only show up in our all funds statement if it came to the state. And so what we are showing on this slide are the funds that we think are coming to the state. What I'm talking about with the broadband funding is that our understanding is it will actually be spent at the federal level, so will never come to the state treasury. And if it doesn't come to the state treasury, then we are not tracking it at MMB.
Thank you, Madam Chair. I think that helps. I appreciate that. I think that kind of helps clarify that interaction between those. I think especially the broadband is something we're very interested in getting deep in that. Thank you.
But what it does do is complements or complicates how much commitment from our state budget that we make to some of these programs, to roads and bridges, with all the federal funds coming through, or to broadband. I mean, setting a budget is going to be very interesting going forward with these federal funds. Any other further questions? Further comments? Director Ratten, are you complete with the deck?
That completes my deck. Thank you so much.
Yes, thank you. Commissioner, would you like to make some final comments?
Yes, thank you, Madam Chair. I just want to thank the committee for the chance to walk through this information. I really appreciate the inquiry, the curiosity, and the breadth of questions, because as you said, Chair, there's a lot here. There's a lot that we've been trying to unpack, and I got to say again, thanks to the MMB staff for doing this, in addition to the regular duties as assigned of putting together the governor's budget or helping other activities in the pandemic response or working through special sessions. So this has been a work in progress. And I just thank the committee for the time and attention on a really important matter.
Thank you, Commissioner. Thank you for being very respectful, and the folks that you work with are extremely talented and committed and respectful too. And let us help you do your job also, is what I'd like to say. I know it's going to be challenging going forward. This is a little more complicated than the other two budgets that I've had the honor of being able to be a part of, but we will certainly get through this. And I was a little surprised that we took up the entire time, but it was well worth it. Members, there is not a planned finance hearing for next week. And we do have the governor's budget coming out on the 26th. So I know you'd like to get back to work on that. And we'll be anxious to unpack that also. So with that, thank you very much. The Finance Committee is adjourned.